So, we quickly identify the parts of it and general features of it, then we will go for the muscle attachments. So, we have three pieces of bone together fixed into this particular bone. We have ilium, which is wide part, expanded part, then anteriorly we have this pubis, and posteriorly and down we have this ischium holding a cavity. We call them as a obturator foramen, right? And we have a socket for adjustment of a bone, we call them as acetabulum or acetabulum fossa, which is accommodating the head of the femur for making this joint, which is known as hip joint. Now, talking about the each bone individually, we have this wide expanded part of this particular bone, we call them as ilium, and ilium have got few features like it has border, which is anterior border, posterior one and superior bone, and which is having a medial border which is separating out from this particular like the lower margins, and it has two surface like a lateral surface which is known as gluteal surface and inner surface which is known as iliac fossa. Iliac fossa and also continues with this particular like a sacropelvic surface which is going down into like the pelvic surface, like which is going down to this inside of the cavity, we call them as pelvic surface, so which is the lower part. So, this particular anterior border have got feature up, down, then we have this ASIS, then we have a notch, then we have anterior inferior iliac spine, and then we have a notch as well. And then moving back to the back side, posterior border also have same posterior superior notch, posterior inferior notch, which is heading to this greater sciatic notch, which is again sloping down into this projections spine, ischial spine, and then we have lesser sciatic notch which is heading to this bony space, we call them as the ischial tuberosity, right, good. And we have two surfaces on this particular bone, which is this one lateral, also known as gluteal surface, can be divided into three parts or four parts like for the attachments like by this inferior gluteal line and the middle and posterior gluteal line, which is making this particular different muscle attachment to it. We have the superior border, we call them as crest, iliac crest, which is having a outer layer or outer lip, inner lip and intermediate area, and this particular intermediate area has like 5 centimeter from this anterior superior iliac spine, has a highest point, we call them as ischial tubercle. Ischial tubercle is the highest point. If you join this particular two ischial tuberosity, we find a line which is hitting that lower border of L3 L4 junction. Now, then moving to this particular surface, we call them a sacropelvic surface, which is attaching with the sacrum, and this particular attachments makes it like a ear like shape, we call them as auricular surface. Then this is bulbous bony part which is present in here, we call them as ischial tuberosity, and then we have this particular like a pelvic surface which is going down on the inferior part. Then we have this particular bone, we call them as anteriorly placed, we call them as pubis, which has got body which is the central part which I am holding. Then we have horns, we call them as ramus, up superior, down inferior, and this particular body have got like few surface, anteriorly anterior surface, posteriorly posterior surface, medially medial border or medial surface, making a union. Which union? This joint we call them as pubic symphysis, this right side pubis, left side pubis, intervened by a cartilage inside which is a secondary cartilaginous joint, making this particular joint, right. There are two types of cartilaginous joint, one is primary, one is secondary. So, primary one, which is this cartilage fuses, becomes bone itself, we call them as primary cartilaginous, just like symphysis menti here. But this one we have this cartilage present, that means the cartilage present makes this joint as a secondary cartilaginous joint. Now, coming to this particular like borders of this particular bone, it has a medial border which is joining here, it has a superior border and inferior border. Superior border, it has a tubercle out here, we call them as pubic tubercle. So, up to this pubic tubercle from the medial end or medial border, we call them as crest, pubic crest. So, pubic crest is this much from medial border to this tubercle, this much. Then from the medial tuberosity, from the tuberosity to this bump over here, we call them as iliopubic eminence. We get a line, we call them as pectinate line. By the muscle attached to it, we call them as pectineus. Now it has surfaces like anterior surface, it has pectineal surface, it has pelvic surface based on this areas like anterior surface. This side we have the pectineus muscle attached, we call them as pectineus surface, and inner side we call them as pelvic surface. So these three surfaces of this particular bone existing to it. Now then we have the ramus, superior ramus, going to this particular acetabular notch, holding in the upper cavity of this or foramen. Here we call them as obturator foramen, which is leading to this particular space, we call them as obturator crest, where this neurovascular structure can groove in. Then we have this inferior ramus. Inferior ramus have got like a joining part with this ramus of the ischium. Now ischium bone has got this particular part, we call them as ischial tuberosity, which is a part of the body, and then we have the ramus joining over here. Together we call them as ischio-pubic rami. So together this lower rami. Now this ischium bone from the back side, it has a projection which is known as ischial spine. And then we have this particular like acetabulum, which you can see that it has a cavity to it, cartilage attached on this margin, we call them as labrum. And then we have this cavity which is having a notch, this gap we call them as acetabular notch. We have a ligament attached to it. Now this acetabulum have got three bones contributing together. Majority of here is coming from here, less than 2/3 is coming from this ischium bone, and this one is that less than 1/3 is communicated by this contributed by this pubis bone. So least contribution is from the pubis, maximum contribution is from ilium. So this is like the general feature that we have learned. Now holding this anatomical position, anterior posterior is identified by this, pubis is anterior and this greater sciatic notch is posterior, and lateral and medial. Lateral is this opening which is present with the acetabulum, which is present on the lateral side. Medial side, which will be the iliac fossa, which is heading this medial side. Above this bone, which is crest, pubic crest, which is above. Down is that like ischial tuberosity, lower ischial tuberosity is down or inferiorly in position. So coming together, we can identify which side it belongs, the left side and left side, right side. So once you have decided left side and right side, then you have to hold it in anatomical position. That anatomical position is that pubic tubercle and along with the anterior superior spine will be same vertical line. So they will be touching together like this. And then if you join a center of the acetabulum to this line, which is known as ASIS, will be on same vertical line. So you have to draw a line from here and then it will be touching it. So it will be like this touching. And posterior superior spine should be 5 centimeter away from the midline. So it will be, you will holding it in anatomical position, little bit tilted down and medially rotated. So this is how you will be holding this. So if you are holding this pelvis, it will be like this. Then we have to learn quickly about the like important muscles and some important ligaments which are attached to it, right. So common point of interest is that starting with this particular ilium bone attachments, which is easy one, will just like breeze through quickly. So easy one is this gluteal surface have got muscles. So gluteal muscles we call them as three of them: Gluteus Maximus, Medius and Minimus. So posterior to anterior which will be there. So Maximus, Medius, Minimus. So these are three of them, right. More anterior you go, you will be Minimus, then Medius and Maximus will be on the back side, right. So this is the blade which is attached to, we call them as this lateral surface or this gluteal surface. Now inner side we have this big area, we call them as iliac fossa, also known muscle attached to it, iliacus. Good. Now coming to these lips over here, this anti-abdominal wall muscles, they are attached to it. So this particular anti-abdominal muscles, just like thoracic muscles, there are three of them: external oblique, internal oblique and transversus abdominis. So outside to inside they are like this: external oblique muscle, internal oblique muscle and transversus abdominis. There are three muscles attached to it, so anterior to posterior on the margins of it, right. So remember this, and on the margins we have this deep fascia. We learned the deep fascia, we call them as fascia lata. So all this outer margin, you see the attachment of the fascia lata. So fascia lata, along with that this anterior 2/3, whereas a muscle is blending on it. we call them as iliotibial tract, which is the condensed part. Into the iliotibial tract a muscle is inserting here, we call them as tensor fasciolata. So, this anterior part of this anterior border of it, we have this tensor fasciolata attached to it. So, tensor fasciolata is attached on this margin, then you have this particular like that fascia lata muscle, all of fascia, all of it attached. Then we have this particular outer leaf, we have this external oblique, internal oblique, transversus abdominis. So, this is how they are attached or anchored in here. Now, then we have these muscles, we call them as a little bit on the like inner side, like this iliac side, like a fossa side. We have a muscle, we call them as like the climber's muscle. We have seen this muscle, climber's muscle, lats. So, latissimus dorsi is like attaching in the this like this region, we call them as like a sacropelvic surface, right. So, this ahead of the sacropelvic surface, we have this muscle attached, we call them as like climber's muscle, lat. This lat is attached on it. Okay. So, this lat or latissimus dorsi is attached on this like on top of this particular muscle. We have this iliacus, and top of that this margin we have a muscle attached, we call them as lat or latissimus dorsi. So, this lat or latissimus dorsi is the one that you have to keep in mind whenever you are learning. This one is lat, like this. Okay. Starting from the like a sacropelvic surface, little ahead of that the lat is attached. Then little bit ahead of the lat there is another muscle which is little bit thick muscle, we call them as arrector spinae, that back muscle. This midline back muscle on the sides of the spine, there are number of muscles are there. There are few muscles are there together, we call them as arrector spinae, that holds the back straight. So, this arrector spinae is little bit ahead of that. Okay. So, these two muscles little bit significant. Out of that this lat is more important, you have to keep this particular muscle because they are significantly climber's muscles. So, you have to know it is a long fanning out muscle and very strong. So, this is about the on the surfaces. Now, coming to the muscles of importance over here and along with the ligaments. So, we have a ligament carvag data, carvag, then why? So, we have a ligament in the abdomen or anti-abdominal wall, we call them as inguinal ligament. So, inguinal ligament is running like this. So, ASIS to the pubic tubercle. So, this inguinal ligament is running like this. So, if it is like this, ASIS to pubic tubercle. So, this inguinal ligament have two ends, one is lateral end, one is medial end. This pubic tubercle is medial end, this one is lateral end. So, these two are extending between that, there is a ligament. So, they are anterior superior iliac spine gives an attachment of a ligament, we call them as inguinal ligament lateral end. The medial end is attached where? Is pubic tubercle. Pubic tubercle in the pubis, which is having a tubercle on the upper border, we call them as tubercle. So, pubic tubercle to ASIS. Now, below that we have a muscle, we call them as sartorius. Sartorius, you have seen that, which is coming from and crossing, which is making a boundary for the triangle, right. So, the same sartorius is attached on this under to this particular inguinal ligament. Inguinal ligament, then we have this sartorius. Then we have this another bump, we call them as anterior inferior iliac spine. In the anterior inferior iliac spine, we have another muscle. We have a muscle, we call them as rectus femoris. So, these rectus femoris have got two origins, one is straight origin, other is reflected origin. The straight head of the rectus femoris is coming here. Another ligament which is under to it, we call them as ilium to femoral. So, iliofemoral ligament. So, these 1, 2, 3, 4 are important, your exam questions. So, ASIS, one ligament, one muscle, inguinal ligament, third transverse, anterior inferior spine, one ligament, one muscle, rectus femoris, straight head of it, and iliofemoral ligament. Okay. So, this bump elevation have got straight head of rectus femoris, and other head of the rectus femoris is attached on the top of this acetabulum notch. So, this rectus femoris takes a straight origin and a curved origin. We call them as reflected head and a straight head of the rectus femoris, which is coming to. Rectus femoris, you have seen that the front of the thigh in the straight muscle, which is making four muscles together, quadriceps, rectus femoris, vastus lateralis, medialis, intermedius. So, that straight one have got two heads, one is going straight, another one is coming from a curved course, like we call them as reflected head. From here it is coming and then getting straighter. So, that is why you call them as reflected head of rectus femoris. So, it is going like one head is going like this and one head is coming like this. So, that is why you call them as reflected head, and they are making the muscle like this. So, this is about the major features of the muscles which are present on the ilium bone, rather very like too many muscles are attached. So, gluteus we can easily figure out, this one is easy to figure out, iliacus, lat, rectus spine, fascia lata, iliotibial tract, which is the anterior part. On the iliotibial tract, on under to it we have this tensor fascia lata. If you can remember, tensor fascia lata is fine, if you do not, no problem, fine. Then we have this anti-abdominal wall muscle, external oblique, internal oblique, transversus, abdominis, and along with their aponeurosis, all these things are there. So, these are the muscles attached on this ligament and muscles which are significant to it. Now, coming to this bone, easy one, ischium. The ischium has got this tuberosity. Ischial tuberosity gives attachment to the hamstring muscles. Attachment to the hamstring muscles. You know the names of the hamstrings. So, hamstring muscles are attached on the ischial tuberosity, right. So, this ischial tuberosity all the way along gives attachment to the hamstring muscles. Now, coming to the rami, ischial rami and inferior ramus of this pubis, we call them as ischiopubic rami. So, ischiopubic rami gives attachment to the all the medial compartment thigh muscles. What you have the medial compartment thigh muscles? Adductor muscles, adductor longus, adductor magnus, brevis, gracilis, all the small muscles which are present on the sides, gracilis, and all along with the medial muscle, they are attached on the side. Clear? So, this one and this one. So, this one is hamstring, this one is medial compartment muscle. Then you know the medial compartment of the thigh, longus, brevis, magnus, gracilis. Okay. Then moving to this particular point, we have this bone. We have this pubis bone. So, this pubis bone have got like features like this. This point is important for this pubis bone, which is known as pubic tubercle. Pubic tubercle gives attachment to a ligament, which is medial part of the inguinal ligament. That is what we have to keep in mind. And these same muscles like the gracilis and all these things, they are encroaching to this particular sides as well. Now, apart from that, we have a muscle covering this region. We have the foramen here, and we call this foramen as obturator foramen. This is the external side of the obturator foramen. So, we call a muscle attached to it, we call them as obturator externus. Deep to the obturator externus, we have a membrane, we call them as obturator membrane. And if you flip to the medial side or pelvic side, we have this muscle extending like this, we call them as obturator internus. So, this obturator internus is encroaching towards the iliac fossa. So, moving like this is a big muscle. So, obturator externus, obturator internus, and in between them we have the obturator membrane. Within this there is a gap. This gap is there for the obturator crest region. Through here obturator nerve, obturator artery, obturator vein passes through or pierces through or is a gap which is runs through it. Clear? So, this pubis bone have got same continuations of the medial muscles which is on the external side is there along with the ligament which is present in here. On an inner side of this pubis bone or also inner side of this ischiopubic rami, we have the muscles, they are attached over here, they are known as perineal muscles. We do not have to remember the names at this point. They are muscles which are present on the perineum. So, we call them as perineal muscles are attached on the inner side. If you can remember, fine, and nobody going to ask you at this level about what are the different perineal muscles. Just know the names of the perineal muscles, later on we will talk about it. So, perineal muscles are attached on the inner side of it. Now, coming to what else we have left with one ligament I have to add up, we call them as iliolumbar ligament. So, it is a kind of like a this particular point where you see that between this auricular surface or sacropelvic surface and this iliac crest, we have a like a attachment of the muscle, we call them as latissimus dorsi. Latissimus dorsi, where it is latissimus dorsi is blended with the ligament, we call them as iliolumbar ligament. So, you can see that this is a strong kind of ligament, a iliolumbar ligament, which makes a boundary of a space. Later on when we are going to study this abdomen, we will talk about it. So, this point where this particular thing ends, we could have a muscle, a ligament attached, we call them as iliolumbar ligament. If you can remember, fine, if not, just let go. And on this particular sacral surface, we have a muscle ligament attached to this particular sacrum, to this particular this ilium bone, we call them sacroiliac ligaments to hold this sacrum with the ilium. So, they are known as anterior sacroiliac ligaments, posterior sacroiliac ligament, interosseous sacroiliac ligament. So, sacrum to ilium, there are ligaments are there which are attached on this particular sacroiliac surface or this sacropelvic surface. So, this is about it, and to add up to one thing about this particular top of this particular this particular iliac crest, we have this particular iliac crest which is occupied by the inguinal ligament part or reflected part of inguinal ligament. Then we have this line, we call them as pectinate line. Pectinate line is occupied by this surface which is related to the pectineal surface. Into the pectineal surface, into this particular bump, we call them as iliopubic eminence. We have a muscle attached, by the name of it we call them as pectineus. So, the pectineus is present on this pectineal surface of the pubic bone or superior ramus of the pubic bone. So, see superior ramus, this one is superior ramus. So, superior ramus have got three surfaces, like this one is pectineal surface, this one is external surface, and this one is pelvic surface. So, this pectineal surface is occupied by this pectineus, and this surface, anterior surface, which is also related to the the femur, or also known as femoral surface as well. So, which is related to the obturator externus, and pectineal border or pectineal surface or pectineal line is related to the muscle, we call them as pectineus. Now, apart from that, we have this the psoas muscle, psoas major or psoas minor muscle, they are attached on this. Just you will learn that later on, because not everything we can remember or not everything we can just produce out here, but we will be remembering the salient or most important muscles for now. Later on, if you have time, we can just further continue to learn about it. But to grossly learn about the parts of it, we start with this particular part of the bone, we call them as ilium, and then we have this ischium, and then you have this three bones are there. Then this part of the bone we call them as acetabulum, this foramen we call them as obturator. Obturator foramen is related to obturator membrane and two muscles, externals and internals, two surfaces of the foramen, easy to remember. Then hamstring muscles, we remember all, tuberosity, which is related to this particular bone where we are sitting actually. Then this gluteal surface, three of the gluteus, back to front we have this max, medius, minimus. More anterior we go, we find the minimus, like lesser small muscles. Then we are going to this inner side, iliacus, by this muscle by the fossa. On top of iliacus, rectus spinae and lat which is present to it. Limited by this particular surface, we call them as sacropelvic surface, where the sacrum and pelvis is uniting together. Now out here on this superior border, we call them as crest. Crest have got like a muscle and the fascias attached to it. So fascia attached here, we call them as fascia lata. Fascia lata, under to it we have this tensor fascia lata muscle which is anchored to it. Then we have the abdominal wall muscle, external muscle, internal muscle and transverse muscle, 3 of them. And then we have this iliacus muscle which is anchoring into it. So we also have this particular like piriformis muscles also coming in it, but I am just like excluding the piriformis for now. And then most important to us is that this particular points. This particular point is that anterior superior iliac spine, we have the muscle attached to it, we call them as like sartorius. We have a ligament attached to it, inguinal ligament, medial lateral part. Medial part is extending from this part to this part, right. Then we have this next bump, we call them as rectus femoris and the iliofemoral ligament, ilium to femur, which is making a joint, which is a part of the hip joint ligament. Now iliofemoral ligament, along with that, then we have this on top of this particular like acetabulum, we have a muscle, we call them as reflected head of the rectus femoris. So 2 muscles are there, pectineal line, pectineus, and this point we have this all the medial muscles, adductor muscles, gracilis, all these things are attached to it, which is extending to this body of the pubis. And on the body on the pubis superior crest, we have this tubercle, we call them as pubic tubercle, and pubic tubercle is occupied by the medial attachment of the inguinal ligament, and it makes a joint here, we call them as symphysis pubis, which is a secondary cartilaginous joint, and the joint which is present on the sacrum, which is a synovial joint. Synovial joint which is joining over the sacrum and the right and left hip bone, and the ligaments which is coming over here is grooved in this particular sacropelvic surface or ischial or this particular iliac tuberosities. Like we have a muscles which is attached to it, we call them as like the piriformis, and then we have these particular ligaments, we call them sacroiliac ligaments, anterior, posterior, interosseous. These are the things which are related to it. Now coming to other ligaments that I want to contribute things to conclude the thing, or 3 of it. So between this particular like ischial tuberosity to the sacrum, we have a ligament, we call them as sacrotuberous ligament, and we between the spine to this particular the sacrum, we have a ligament, we call them as sacrospinous ligament. So sacrotuberous, sacrospinous, 2 ligaments are there, they are converting this notches into the foramens. You see that this ligament which I am placing right now, which is coming from the sacrum body and ending on the spine. So we are going to call that as sacrospinous. What they are doing, it is converting this greater notch into foramen. So this ligament is converting this notch into greater sciatic foramen in living condition. Similar to it is a ligament which is going to the ischial tuberosity to the sacrum, we call them as sacrotuberous ligament. What they are doing, they are making this notch. What notch is the lesser sciatic notch into the foramen. So in a living condition, they are present like this and converting these 2 into notches into foramen by their anchorage. More we just like explore through, they are cut and we get this bone. So these 2 ligaments that we have to add up, and between this particular notch of the acetabulum, we have a ligament joining these 2, we call them as transverse ligament, transverse between the acetabulum. So we call them as transverse acetabular ligament, so which is running between the gap over the under margin of this. Now this particular ligament under to it, we get a foramen or kind of like a slit is there, right. So this neurovascular structure can pass under to it. So it is not bridging the thing, it is present on the margin of it, and then still the blood vessels, nerves can go through and go and supply the head of the femur. Like the blood supply to the head of the femur, blood supply to the neck of the femur. So is present to it. So there are so many complex names and so many complex ligaments are there. So as much as you can remember, you remember it. If not, that's fine. Still we can do good. So you just like take time with your friends, just like a saliently like a feature of this particular bone muscle attachments. If you have any doubts, clear it out now. Then we have a small bone to cover, which you already know. Just like I want, just add up. করে নাও দেখে নাও একটু চট করে তোমরা নিজেদের মধ্যে লিগামেন্টাম টেরিস হেপাটিস না ওটা ট্রান্সভার্স অ্যাসিটাবুলার লিগামেন্ট আর লিগামেন্ট অফ দ্য ফোবিয়া অর হেড সেটা অ্যাসিটাবুলার লিগামেন্ট এই সেন্টার অফ দ্য অ্যাসিটাবুলামে থাকে এটা হচ্ছে ট্রান্সভার্স অ্যাসিটাবুলার লিগামেন্ট আর ওটা হচ্ছে লিগামেন্ট টু দ্য হেড অর ফোবিয়া অর পিট সেটা হচ্ছে ওই ভেতরের থেকে লেগে থাকে এইখানের থেকে ভেতরের থেকে center of the acetabulum to the pit of the femur. ওই মাসেলটা রামাই কি রামাই ইসচিও পিউবিক লেক
তিনটে লাইন কি বললেন
একটা আছে ইনফিরিয়র গ্লুটিয়াল লাইন ইনফিরিয়রটা তলাটা লোয়ার মার্জিন এই যে এইরকম জায়গায় অ্যাপ্রোপ্রিয়েটলি ওই যে গ্রেটাসায়াটিক নচের মোটামুটি মাঝামাঝি একটা জায়গায় কর নাও হ্যাঁ এটা তলাটা উপরেরটা সারফেসটা হয়ে গেল তো হ্যাঁ আর এটা মিডল গ্লুটিয়াল লাইন আর পস্টিয়ার গ্লুটিয়াল লাইন আর মিডিয়াল গ্লুটিয়াল লাইন
এটা পস্টিয়ার গ্লুটিয়াল তো অ্যান্টিরিয়রে আছে
না সরি এইটা তাহলে পস্টিয়ার গ্লুটিয়াল এটা মিডিয়াল একটু অ্যানাটমিক্যাল পজিশনে ধর তাহলে পস্টিয়ার গ্লুটিয়াল লাইন আর medial gluteal line আর inferior gluteal line এটা inferior gluteal line এইটা posterior medial middle or intermediate ঠিক আছে
এটা কি
middle or intermediate যে কোনো হলেই হলো
posterior gluteal line middle or intermediate gluteal line inferior gluteal
কি হলো বুঝিয়ে দে ওরটাই বুঝিয়ে দে ওর মঞ্চটা বুঝিয়ে দে ওর মঞ্চটা অ্যানাটমিক্যাল পজিশনে ধর অ্যানাটমিক্যাল পজিশনে ধর আগে না ওকে ধরা অ্যানাটমিক্যাল পজিশনে ধরতে দে আগে দাঁড়া ওকে ধরতে দে ধর তুই দেখ ওটা কি করে ধরেছে দেখ আমার দিকে তাকিয়ে কি পয়েন্টটা ধরতে বলেছিলাম ধরা এটা অ্যানাটমিক্যাল পজিশন ঠিক আছে অ্যানাটমিক্যাল পজিশনে ধরে দেখা আমাকে হয়নি অ্যানাটমিক্যাল পজিশনে ধর ठीक करे एनाटॉमिकल पोजीशन धर आगे पहले ठीक से पकड़ो एनाटॉमिकल पोजीशन में ठीक से पकड़ो हम मेरे मुख से ना देखो बोन से देखो मुझे एनाटॉमिकल पोजीशन में नहीं पकड़ना है आपको पकड़ना है पकड़ो ठीक से पकड़ो दोस्त से बात करके पकड़ो ठीक से पकड़ो नहीं तो जीरो हो जाएगा ऐसा है आपको पढ़ाया तो आपको पकड़ना है ना देखिए ठीक করে দেখিয়ে কি হয়েছে কোন দিকে রাইট কোন দিকে রাইট তারপরে কি করে হলো বই বার কর সব বই বার কর হ্যাঁ বই বার কর তোদের বই কোথায় এখনই বেঁচে দিয়েছিস তো হ্যাঁ ওটা কি ধরেছিস রে ও দেখ কি ধরেছে হুকোর মতো ধরেছে কি করে অ্যানাটমিক্যাল পজিশন ধর অ্যানাটমিক্যাল পজিশনে পকড়ো হ্যাঁ ওই দেখ দেখেছিস কিরকম করে ধরেছে